Hi everyone, welcome back to the second video of this lecture. So for this video, we're gonna discuss on the ergosterol biosynthesis inhibitors and other antifungal drugs. Besides targeting ergosterol itself, many other antifungal drugs have been designed to target enzymes involved in the ergosterol biosynthesis. This ergosterol biosynthesis in fungi utilize a compound called squalene as a starting material. In the presence of enzyme called squalene epoxidase, squalene is transformed into lanosterol, which in the presence of cytochrome P450 enzyme called 14-alpha demethylase, which subsequently converted lanosterol to ergosterols. So, one of the most pharmacological class of antifungal medication that targeted fungal squalene epoxidase known as allylamine, which include drugs such as terbinafine, naftifine, and butanafine. So, terbinafine will inhibit fungal enzyme squalene epoxidase, which lead to accumulation of this squalene. So this squalene is toxic to the organism and lead to fungal cell death. So what you need to know, this group of classes are effective against most cutaneous mycosis caused by the T. rubrum, Trichophthalo rubrum, Trichophthalo metabolite, Mycosporum canis, Mycosporum gitium, as well as the Epidermophytum floccosum. This microbe, the most common cause of dermatophytosis disorders such as tinea capitis, which affected in the hair or scalp, tinea pedis, which affected in the foot, and the most common one is tinea unguum, or known as onychomycosis, that affected at the nail of the patients. So only terbinafine are available in oral formulation as a brand name Lamizil. It is because only terbinafine is well absorbed. Meanwhile, the other allylamine agents are poorly absorbed in the GI system. However, the bioavailability of this terbinafine is decreased to approximately about 40% due to first-pass metabolism in the liver. The drug is highly bound to plasma protein and can accumulate in the skin, in the nails, as well as in the fat, which cause the half-life about 12 hours and can extend to 200 to 400 hours at steady state. Because of this, terbinafine is not recommended to exothermia and hepatic failure patients due to unpredictable amount of plasma drug concentration. Another antifungal drugs that impair the biosynthesis of ergosterol is the Azoles group of antifungal agent. So these azoles will target this 14-alpha demethylase. By inhibiting this enzyme, this azole will deplete the cell membrane ergosterol, thereby impairing the membrane fluidity, which can cause leading accumulation of 14-alpha methylsterols. So this 14-alpha methylsterols is the toxic sterols that can cause fungal cell death. So the azole antifungals include two broad classes, which are the imidazoles and triazoles. The drug available in the market, such as clotrimozoles, miconazole, and icanozole, are the imidazole. Meanwhile, itraconazole and fluconazole are the triazoles. They share the same antifungal spectrum, and imidazole and triazole also share the same mechanism of action. The only differences between these two are the triazoles is slowly metabolized in the liver, and the triazole also has less effects in human sterol synthesis compared to the imidazole. That is why triazoles such as fluconazole can be used as a systemic antifungal agent that can be administered either orally or intravenously. Meanwhile, imidazole only used for topical treatment of fungal infections. As mentioned before, The spectrum of action for this azole group of antifungal class is broad, including many species such as Candida species, Cryptococcus neoformans, endemic mycosis, as well as dermatophyte strains. As mentioned before, both intraconazole, fluconazole, and voriconazole has high oral bioavailability. The bioavailability of itraconazole can be increased by taking simultaneously with foods or make the gastric pH more acidic. However, they are targeted on microsomal enzyme 14-alpha demethylase also can be extended to non-targeted inhibition of cytochrome P450, which is responsible of pharmacokinetic drug interactions. So intraconazole and voriconazole shows drug-drug interaction because of these two agents is the cytochrome P3A4 inhibitor, which reduce the drug bioavailability of rifampin as well as tacrolimus and statin. These inhibitions of the cytochrome 3A4 can lead to therapeutic failure. In contrast, fluconazoles can penetrate the blood-brain barrier and can be used as coccidioidal meningitis. Okay, what you need to know that both of these two enzymes, which is the squalene epoxidase as well as 14-alpha demethylase, also present in human cells. Although human enzymes are less affected with these antifungal agents, there is still a potential for non-targeted inhibition which can lead to adverse effects such as rash, visual disturbance, and photosensitivity dermatitis. There are also some antifungal drugs that you may encounter later in the clinical practice, that is Griseofulvin and Flucytosine. Unlike the cell wall targeting antifungal that we had discussed thus far, this Griseofulvin as well as the Flucytosine work by disrupting target fungal cell division via mechanisms similar to cancer chemotherapeutic agents. Specifically, Griseofulvin shows fungostatic activity by binding to tubulin, disrupting microtubule function and thereby disrupt assembly of the mitotic spindle and inhibiting the fungal cell mitosis. So this Griseofulvin can be used to treat dermatophyte infection, particularly in the Trichophyta species, Macrosporus species, as well as epithelial flocosum. It can be used to treat tinea capitis, tinea cruris, because of this drug deposit in keratin of skin, hairs, as well as nails. It will absorb in the as a oral, as it produces peak plasma concentration of 1 microgram per ml within 4 hours. However, this drug is rarely used as always being replaced by newer antifungal medications such as itraconazole and terbinafine. Flucytosine. So another one of the antifungal agent that works at the nucleus level. So this flucytosine required them to enter the nucleus fungal cells through the cytosine permease to convert it into 5-fluorouracil and then to other active metabolites that inhibit fungal RNA synthesis as well as the fungal DNA synthesis. I believe everyone is familiar with fluorouracil, or their abbreviation as 5-FU. Yes, this is a potent anti-metabolite that you had learned in cancer chemotherapeutic PHC 636. So, all susceptible fungi are capable of deaminating flucytosine to fluorouracil by this enzyme cytosine deaminase. So fluorouracil is metabolized first by uracil phosphoribosyl transferase to 5-FUMP. So this 5-FUMP is either incorporated into RNA or metabolized to 5-FDUMP. This 5-FDUMP, or known as 5-fluoro-2-deoxyuridine 5 monophosphate is a potent inhibitor of thymidylate synthetase, which cause lack of thymine and then may impair in the DNA synthesis. This drug, flucytosine, is highly selective toxicity. It is because in our human cell we have lack of this enzyme cytosine deaminase. Compared, there is a lot of fungal strain. There is a lot of enzyme present in the fungus. So the lack of this enzyme in the cytosine in the human cell will prevent the metabolism to fluorouracil. So this flucytosine is absorbed rapidly and well GI tolerance. It widely distributed and minimally bound to plasma protein. Is excreted unchanged in the urine and has half-life about 3 to 6 hours. The good thing, this drug is able to penetrate to aqueous humors as well as the blood-brain barrier. So because of this reason, this drug usually when combined with N4B to treat the cryptococcal meningitis in the patient as well as cryptococcus meningoencephalitis. However, fungal resistance can be occur due to loss of cytosine polymerase in the cell membrane. This cytosine polymerase is important to transport the full cytosine into the cells. The resistance also can be occur due to decreased activity of this cytosine deaminase enzyme or decrease the activity of uracil phosphoribosyl transferase. Another one of the fungal resistance incident can be occur when the thymidine compound to be replaced by cytosine in nucleotide gene sequences cause the cytosine become an arginine. However, this flucytosine also can cause untoward effect, especially able to depress the bone marrow and lead to leukopenia and thrombocytopenia. These incidents are more prone to patients who has the underlying hematological disorder or being treated with radiation or drugs that injure the bone marrow. That's all for today. If you encounter any problem, please do not hesitate to contact me through WhatsApp or you can email me. Have a good day everyone. Stay safe. Bye.